everyone, I'm Alex Mehrens, and today I will be talking about ketosis and type 2 diabetes, more specifically, how the ketogenic diet can reduce the effects of type 2 diabetes, more specifically in people that are either pre-diabetic or have just been diagnosed with diabetes. So first, I'm just going to discuss what we're going to be talking about today in this presentation. So first, we're going to discuss what the ketogenic diet really is and kind of dive into that a little bit. Then next, we're going to discuss what type 2 diabetes is, and then talk about relevant research regarding both the keto diet and type 2 diabetes. Then we're going to look at some studies looking at both the ketogenic diet and its effects on type 2 diabetes. Like I said, specifically with people with that are pre-diabetic or have just or are obese or have just become diabetic. Then I'm going to talk about my final thoughts and concluding statements about this research found and all this information provided. So first, we need to talk about what are carbohydrates. Basically, carbohydrates in simple terms are simple sugars. Carbohydrates are one of the three main nutrients found in foods that we eat. Carbohydrates are made up of, the three elements, carbon, hydrogen, and oxygen. The most abundant forms of carbs usually come in the sugars, fibers, and starches. Some of the foods that contain carbs can be bread, pasta, potatoes, corn, fruits, vegetables. Those are all foods and food groups that contain carbs. Now, what are the functions of carbs? Well, basically, carbs function as the main energy source for the body. They are used for short-term energy, unlike protein and fat. So carbohydrates are broken down into glucose, which then regulate the blood glucose levels in our bodies. They are used in energy storage, so carbs get stored away, and then they are used for energy later on. But again, it is short-term energy. Carbs are very important when it comes to a person's physical activity. It gives you energy to get through the day or when you're working out. And it helps with triglyceride and cholesterol metabolism. So then, what is the ketogenic diet, or what is ketosis? So ketosis is when a person's metabolic state gets to the point where it starts using fat as an energy source instead of the glucose, or, the carbohydrates that then get converted into glucose. This is when the diet starts to limit carbs and are typically found in grains, starchy vegetables, fruit, like I discussed before. To reach ketosis, limiting carbs and increasing fat and protein is the ultimate goal. You want to limit the carbohydrates super, super low, and you really are increasing fats and protein. As I have in the photo in the corner, it's 20% protein, 75% fat, and 5% carbs. So very, very small amounts of carbs. Next, so eating more foods and high fat and protein is supposed to help a person feel fuller longer. Hence, they should be eating less food, which then helps them reach ketosis since they will not be eating as many carbs. And that's why so many people trying to reach ketosis have higher amounts in those macronutrients. So then what happens when someone is in ketosis? Well, the body will start using fat stored as the main energy source since carbohydrates are not available or not being provided to the person. Your body begins burning fat and making ketones, which are used for fuel, like instead of the glucose or the carbs that you would be usually consuming. So many people tend to try the keto diet when they're trying to lose weight. It's a very on and off diet. I feel like it's not a super long-term thing. It's more to lose weight pretty quickly. The diet could possibly help with chronic illnesses, and that's what we're going to talk about, the type 2 diabetes. And then some side effects of ketosis are fatigue, dry mouth, weight loss, and decreased hunger and thirst. Of course, when your body is changing like that and you're removing carbs super early, there's obviously going to be effects like this happening. So then what is type 2 diabetes? Well, type 2 diabetes is when the pancreas produces less insulin that's used, which results in a person becoming insulin resistant. This can cause a person's blood glucose to be too high, which is also known as high blood sugar. So basically the whole idea behind type 2 diabetes is a person becomes insulin resistant and your body isn't able to make it anymore. And that leads to people commonly gaining weight and everything like that because of their diet. So type 2 diabetes is the more common of the types of diabetes, because there is type 1 as well. And the body has trouble regulating the sugar in the body, hence because they become insulin resistant. This can then lead to a person falling into the pre-diabetic stage, and many fall into the diabetic stage. So what is the cause of type 2 diabetes? As I was saying, type 2 diabetes was more commonly found in older adults before, but as the years have gone on, more into the 2000s, like type 2 diabetes has started to develop more and show up more in children and younger adults, which was not usually the case before. It was usually people in their late 30s. So there's been a rise in the United States with children and adults. It's more common in children now due to the lack of exercise and poor diets. This can be, fast food, quick, easy food that is not nutrient efficient, doesn't provide good nutrients, and that can really affect someone into getting type 2 diabetes. Type 2 diabetes tends to be caused by the obesity or overweight individuals. Other factors could be genetics, age, and race, but it's mainly lack of exercise and poor diet. So the keto diet and type 2 diabetes. So after looking at both what a ketogenic diet is and the type 2 diabetes, it is time to explore if one can impact the other. The reason a keto diet can help with type 2 diabetes is because it helps the body maintain low blood glucose levels. Since the diet includes little amounts of carbohydrates, there are not large fluctuations in blood sugar levels. The key idea is here, since a person is limiting their carbohydrate intake, it can help with the glucose levels. So that's really the whole idea behind someone trying a keto diet when either pre-diabetic or they have type 2 diabetes. Now, the research questions here basically what I've been looking at is, does a ketogenic diet help improve type 2 diabetes in people that are diabetic or pre-diabetic? So first, we're going to look at this case study. It was the effect of a periodic ketogenic diet on newly diagnosed overweight or obese patients with type 2 diabetes. So some background information: the number of obese people has been increasing over the years, as I've said. There's been a higher body mass index, or BMI, the higher chance of type 2 diabetes then. Recent data suggests that a low-carb diet, adequate sleep, and proper exercise can help control blood glucose and lower body weight with type 2 diabetes patients. The purpose of this study that was conducted here is to observe the efficacy of a periodic ketogenic diet. So first, the methods that they used is they took a total of 60 overweight patients, obese, or newly diagnosed to type 2 diabetes, from outpatient service of endocrinology department hospital, where these participants took place in this study. They were randomized into two groups. So one went to the keto diet, and then the other went to the control group, which is the control group was routine diet for diabetics. So there were 30 cases for each group, so 30 people per diet. The dietary pattern lasted 12 weeks, and during the period of time, blood glucose, blood lipid, body weight, insulin, and uric acid was taken before and after the intervention. So the results after this 12-week period was that there was a decreased rate in BMI, triglyceride, cholesterol, LDL, HDL, fasting glucose, fasting insulin, and hemoglobin when it came to the keto diet versus the control group. The keto diet did show a more significant decrease compared to the control group, though. People were less willing to stick to a keto diet long-term when compared to the routine diet set for diabetics. The keto diet showed that, so then basically the conclusion with this was the keto diet showed that it can control weight along with blood glucose and blood lipid in patients that are overweight or obese and type 2 diabetes. It's hard to keep a keto diet going long term. It can be a temporary model diet. It could be a good option for people newly diagnosed as overweight or obese with type 2 diabetes. This is helpful because it doesn't require medication. It can be a good way to achieve proper glucose levels in the short term. So that's basically this study. This was what was found and how it was conducted. The second study was an online intervention comparing a very low-carb ketogenic diet and lifestyle recommendations versus a plate method diet in overweight individuals with type 2 diabetes, a randomized controlled trial. So here, type 2 diabetes is a prevalent chronic disease and a diet that plays a role in it all. In a previous trial, it was found that a very low-carb diet can change lifestyle with a change in lifestyle factors helped overweight people with type 2 diabetes. This was an in-person intervention. The aim was to try and determine if an online intervention based on previous recommendations or an online diet program based on American Diabetes Association would improve glycemic control and other health outcomes among type 2 diabetes individuals. So the methods they use is they randomized overweight adults with a BMI greater than 25 with type 2 diabetes. Some of them were assigned to a 32-week online intervention based on previous recommendations, and the others were assigned to a 32-week online diet program based around the plate method. They would assess the impact of how the intervention influenced their glycemic control and other health outcomes. So the results, so after the 32 weeks, the participants in the intervention group reduced their HbA1c levels more than participants in the control group. More than half of the participants in the intervention group lowered their HbA1c to less than 6.5% compared to the control group, which was 0%. A greater percentage of participants lost at least 5% of their body weight in the intervention. Participants in the intervention group lowered triglyceride levels more than the participants in the control group. So the final conclusions in this study were participants that followed a keto diet improved their glycemic control and lost more weight compared to the control group. Online delivery of the keto diet and lifestyle changes could allow for possible successful management of the type 2 diabetes. So that's what this study looked at here. And then my final study that I will talk about was an animal study, and it was the effects of low carbohydrate diet and the ketogenic diet on glucose and lipid metabolism in type 2 diabetic mice. So this is very interesting since we're looking more from an animal perspective, and then maybe we can apply it to humans. So basically, background information, the keto diet has been shown to have many benefits in reducing the blood glucose levels. There have been concerns about the possible side effects, like hyperlipidemia and hepatic ketosis. The goal of this study is to try and explore the possibility of a low-carb diet instead of the keto diet on mice with type 2 diabetes. So the methods they use is they use mice with type 2 diabetes. They were either fed the standard diet, high-fat diet, a low-carb diet, or a ketogenic diet for 14 weeks. They conducted glucose and insulin tolerance tests. By the end of the study, blood and liver samples were collected, and it looked at the biochemical indicators, hepatic, lipid, and glycogen content, and the expression of mRNA and protein. The results from this study is there were reduced blood glucose observed in both low-carb and keto diet. There was an improvement in glucose tolerance and insulin sensitivity. The keto diet decreased liver glycogen content and promotes gluconeogenesis. The keto diet increased lipid oxidation and reduced liponeogenesis. Hepatic lipid content increased. The low-carb diet reduced triglycerides and markers of liver damage. Conclusions from this study, both diets are effective in lowering blood glucose, improving glucose tolerance, and raising insulin sensitivity. The low-carb diet plays a role in inhibiting hepatic gluconeogenesis and improving lipid metabolism. Both diets have different effects on glucose and lipid metabolism. A low-carb diet may have more benefits for the type 2 diabetes. Again, looking at both of these diets, I think they could both be potentially good in either sense. They both showed positive results for helping with type 2 diabetes. So some concluding statements after this. So after looking at all these studies, should a person be diagnosed with type 2? Someone diagnosed with type 2 diabetes, should they try a ketogenic diet? Overall, the keto diet seems to have more positive than negatives. After looking at studies, research, everything, it seems to have more positives than negatives. It could be a great method to try short-term. I think there needs to be more research on the possible long-term, like someone doing long-term ketogenic diet. It's worth trying if someone is newly diagnosed with type 2 diabetes or on the path to developing diabetes. I think it's good to try out if a person's willing to not do medication right away and they want to adapt their lifestyle and their diet in a natural way, not so much in the medication way. So therefore, if a person's willing to commit to a keto diet for a period of time, it could result in benefits for them. And that's all I have. Thank you so much.